Okay, so this has been the main disease that has fascinated me for quite a long time. And if you go and read much of the literature, I had one student that I gave a case report project for that he had to write up, finally a vet student. And one of the challenges that he would have is if you go to the traditional literature on this particular problem, you're going to encounter. It's quite old. It's mostly written by pathologists who they only see the animals when they're dead, usually, and they don't really have a perspective on the clinical cases that are out there. So the late Linda Munson and a colleague of mine, Emily Mitchell, have done quite a lot of work together on this, but looking at surveys. Most of these cases, however, just get a very little idea of how these animals present. And I've found it a little bit of a difficult challenge to try and now put together a whole bunch of case reports for it, which is kind of what I have to do. All right, so it's a chronic disease. It probably goes on for years in cats and largely is unnoticed. Right, so very few cats that actually have got gastritis actually manifest in any sort of clinical way that anyone would notice. More than 90% of cats are affected in captivity. And this is the first paper that came out, the gastritis associated with, again, you see immediately they point in one direction and make that association. And this is where things started to go wrong, really, right from the very start. This was in 1993, the paper by Eaton, and they associated it right then with gastric spiral bacilli in cheetahs. All right. And then once you've made that association, it is almost impossible to get people to start thinking in a very different way about the disease, because it becomes almost law, once it's once it's been published. Gastritis in the cheetah, this is from that paper, was somewhat similar to the gastritis caused by Helicobacter pylori in human beings. All right, so there was the link that was made right from the start. What do we see? The lesions that we get, they mainly in the fundus, the stomach. It's got three different parts: the cardia, the fundus, which is the main glandular part of the stomach, and then right down the bottom, the pylorus, where it exits into the duodenum. But it's mainly the glandular part that is affected. You get this infiltration of plasma cells, which are white blood cells, B lymphocytes, into this superficial lamina propria. And then you also get this gland hyperplasia, as well as over time, eventually you get some parietal cell, which we spoke about yesterday. The parietal cells produce the hydrochloric acid. You get necrosis, they die off and become atrophied. And then you eventually get sort of some degree of fibrosis. Now the difficulty is that sometimes you see, when you scope the stomach, you can see the changes, if it's been quite chronic and if it's quite severe. But the macroscopic view of the stomach is often not that clear, and you have to actually take a biopsy, and yeah, you can see all these dark cells over here, little black or dark purple cells. Those are the B lymphocytes that are, and B and T lymphocytes that have infiltrated the area, and that's what a normal stomach would kind of look like. What do we see clinically? Well, most cases, absolutely nothing, perhaps a bit of diarrhea or a soft dark stool. In most cases, these animals are still eating normally. There's no loss of appetite. There's no weight loss. I've looked at trying to see associations between body mass indexes in animals that have got grade 3 gastritis versus those that have no gastritis, and there's no real correlation with that. We don't see any real weight loss. Sometimes you might see a mild regenerative anemia, but other than that, usually not very much at all. Just in terms of the fecal scale, I'm sure that many of you use this kind of fecal scale or something similar, right? And basically just trying to score them, and I think this is a very good practice, just to keep a track of most of the animals and what is happening with regards to their feces. Most carnivore feces should be, 90% of the time, it should be dry and well formed. All right, they absorb quite a lot of the moisture from the colon, right? So normally you would not expect them to have a soft stool. So anything towards a type 5 behavior is sloppy and wet. Ideally, I would say that you would want something that's along the lines of 1 and 2. Occasionally, if they eat a large amount of muscle meat, or if you give them liver and they eat a large amount of protein with very little collagen in, they will get a sloppy stool one day, but then the rest of the time they return back to normal. If they eat a large number of bones, you'll see that the stool becomes actually quite dry, and that's normal again. People think that there's no association between dry stool necessarily and constipation. Most carnivores produce a mucus in the colon, which allows even dry stools to be actually passed without any real problem. If there's an obstruction or if there's low motility, then you can obviously get constipation. Right? But just simple dryness of the stool is not necessarily going to cause any constipation. Right, in severe cases, however, we can see vomiting, regurgitation, melena, which is basically just a dark black stool, and diarrhea, undigested meat in the feces. Right, that's usually a sign that you've got a severe maldigestion situation going on. So the meat passing all the way through. And then obviously secondary things like poor coat condition. Most cases I perceive will likely to have a small intestinal bacterial overgrowth, although that per se is very difficult to actually define, because we never actually count the number of bacteria in the small intestine. It's actually a very difficult thing to actually, we don't even know what normal is, although we would expect, because of the gastric acid, that, as I said yesterday, there will be a very low number of bacteria in the intestine. There are some tests that we can do on blood looking at vitamin B12 and folate and their ratios, but those for me are very non-specific, and it has to be really severe and long-lasting before you actually get changes in vitamin B12 and folate levels in the blood. Hypochlorhydria, again, it's actually very easy to measure pH. It's one of the easiest things to measure, but if you stick a scope in, you can get a sample and measure the pH. But the big problem with that is that's a spot sample, and it has no relation to when the animal is eating. So actually trying to measure hydrochloric acid production in an animal, or even in humans, is actually a very difficult thing to do. We now have these little loggers that they use in humans that they place with an endoscope in your distal esophagus to measure pH and record it over a 72-hour period, 2 or 3 days. And then they look at how much reflux you get in the distal esophagus. Now those same little loggers, we can place them in the stomach, and they kind of suck to the actual mucosal surface of the stomach, and we can measure pH there. But they are almost 10,000 Rand, which is about $1,000 each, and they're single use only. So you basically it's quite a challenge to actually measure pH. And they also don't necessarily, they measure spot pH in the actual stomach at any time, but they don't necessarily measure total gastric acid production. So it's quite a challenge to measure pH. You often get esophagitis, so when I scope them and you go down with the endoscope, you will see that the esophagus is sometimes inflamed. And then you also get aspiration pneumonias, not very common, but because of this chronic regurgitation, I've had cases where they then they regurgitate whilst they're lying down, and then they aspirate the stomach fluid. Now, where that then can cause a low-grade bacterial bronchitis, where they have a chronic cough, but as in some cases it can also cause a full-grade, sort of pneumonia, full-blown pneumonia. And animals can die from that. Probably the most common cause why animals die from gastritis is actually not a common cause of actual mortality. I said it's just or direct cause of mortality. They hardly ever die of this. They just live with this problem for years and years and years. Almost certainly it has secondary problems, because you can't have that level of inflammation in the body, maldigestion, and not have some sort of consequence for the actual overall health of the animal. So it almost certainly has influence on longevity of the animals, but as a direct cause of mortality, it's hardly ever the case, even though some of these reports would say that it's responsible for about 30% of deaths. Those, again, it's a pathologist's view. They're seeing animals that actually have died and then also have gastritis. What is very, very important here to recognize is that, and I've scoped probably a few hundred cheetahs with gastritis, none of them have gastric ulcers. So this typical peptic ulcer that we would see in humans with Helicobacter pylori infections, we just don't see that in cheetahs. The only actual cheetahs that I've seen with actual ulcers are two individuals that were released from captivity into a wild situation. So they went from captivity into a reserve where there were actually quite a lot of leopards around. And these animals, I think the combination of they really pushed them quite hard in order to try and get them to hunt. And they lost quite a lot of body condition, and they were pacing up and down the fence. And when I immobilized them again and had a look, they had these pinprick ulcers sitting in the pylorus with the typical sort of what we see, what we call coffee granules, which is basically bleeding and then it becomes digested by the hydrochloric acid and turns into like a brown granular sort of mucus discharge on inside the stomach, which is clear evidence of usually of ulceration. And you can see the ulcers, the pinprick ulcers there. But in most cases with gastritis, you don't see that. You don't see any sort of ulceration at all. It's just the inflammation in the superficial layers of the stomach. The diagnosis itself is quite tricky. I usually get a very strong idea from the history and what the animal is fed. And as I said, I can almost, before the person opens their mouth, they'll say it's eating horse meat and it's being fed twice a day. And then before you even go in, regardless of what the symptoms are, you're probably going to find a grade 3 gastritis on histopathology. The fecal consistency usually gives you a clue. Sometimes you can look at fecal smears as well and see changes in bacteria. I don't think that's very reliable. Serum biochemistry and urine biochemistry, I've now extensively studied to try and find little clues of other tests that would help us to diagnose this. And in most cases, it appears to be fairly normal. I'll show you a few variations, but it's not consistent enough or specific enough for you to make a diagnosis. And so ultimately, the only way of diagnosing it is to actually scope the stomach with an endoscope and then take, as in that video over there, take gastric biopsies. And normally we would take about 9 or so biopsies, 3 from the pylorus, 3 from the fundus, and 3 from the cardia, and then we submit them. And there's a well-established scoring system. So we go from a grade 0, which is no gastritis, 1, which is mild, 2, which is sort of moderate, and then 3, which is usually severe gastritis. And as I said, sometimes you can see, now having looked at so many stomachs, you can see when you've got nice, smooth, rugal folds in the stomach, you get those wave-like folds inside the stomach. If they're nice and smooth, then looks okay. If it gets really, really severe, you can get what we call this cobblestone effect inside the stomach. But sometimes you don't even see that, and yet there can still be a fairly severe inflammation or inflammatory pattern on the histopathology. Possible other differential diagnoses or alternative causes for the problem. Renal disease can cause some inflammation in the stomach. You can obviously get gastric ulceration, which can result in vomiting. I've seen wild cheetahs too that have come in, if you bring them into a hospital situation, and they are very stressed by the close proximity to humans, especially if they're really not used to being around humans, then I've actually seen cheetahs develop a full-blown gastric ulcer, which is then perforated, and they've bled to death, basically, from a perforated gastric ulcer. Right, so those situations, that's a very different cause. That's an acute, severe gastric ulceration that develops due to stress. In the same way that humans can, also develop a gastric ulcer from stress, and then we can also develop severe anemia and severe blood loss from a very bad ulcer. There's a little worm that occupies the stomach of many sort of felid species called Oleolanus tricuspis. We don't get that in Africa. Southern Africa, it's not very common. It's more common in Europe. I'm not sure whether it's found around here. But it's very unlikely to play much of a role. It does cause regurgitation and vomiting in cats and can cause a problem in cheetahs as well. Coccidiosis is really a problem only in very young cheetahs, where they more often develop diarrhea, but could also be vomiting. And then panleukopenia, which is the same panleukopenia that the parvovirus that we have in cats, domestic cats, very often affects cheetahs. Actually, cheetah cubs can also be affected by the canine version, the canine parvovirus, and become very, very ill with that. So it's certainly not, I've never seen older animals older than about 2 years ever being affected by panleukopenia. So very few of these, I mean, they're usually distinct from lymphoplasmocytic gastritis, and so it's not usually that difficult to make a diagnosis. Now, the historical treatments again center around the way in which we treat Helicobacter or have treated Helicobacter in humans. And so they always talk about this triple therapy. So it's usually a combination of 2 antibiotics. In this case, they used metronidazole and amoxicillin together with a proton pump inhibitor like omeprazole to reduce the stomach acid. All right, and this is found that this does improve the situation. Okay, they often do improve on this treatment. All right, but they only improve for a period of time, and then they relapse again, and they become, get as bad as they were before. So it's a very temporary treatment, and I've always argued really that the antibiotics in here are the thing that are mainly helping with the infection, probably not with the Helicobacter infection so much as the small intestinal bacterial overgrowth that you have as a secondary problem of, with reduced stomach acid production. And now adding a proton pump inhibitor, which is going to completely wipe out your actual stomach acid, is really not helpful. The animal might feel a bit better, especially if it's regurgitating and got a bit of a esophagitis, but as long as they don't have any sort of ulceration in the stomach, as I said, which is very, very rare, I don't see any point in using that. Okay, in terms of the possible causes, we've talked a little bit about this, Helicobacter pylori. But as I said, wild cheetahs, I don't think I said that, yeah. Actually, wild cheetahs have been positive for Helicobacter as well, and they don't have gastritis. I always find it very funny when I'm scoping cheetah 2, the small animal vets in the hospital, I mean, they scope dogs occasionally, and then they are horrified to hear that you see that I'm not wearing gloves, because I'm going to get Helicobacter from and I say we were scoped, a few hundred cheetahs before. Probably most of them have got Helicobacter, and I've never got Helicobacter from it. So it's not even in humans, I mean, most humans will be exposed at some stage in their life to Helicobacter. And the big question in humans is, why do some people then get an actual active infection, and why do others not? It's easily transmitted between people, by saliva and so on. So, it would be, if it was really an infectious agent that moved from one person to another, we would have epidemics of the stuff, and we really don't. So, still a lot of questions around that. But wild cheetahs, as I said, also have Helicobacter, and they don't necessarily have gastritis. So, this cause and effect, is really not easily to demonstrate using that. Stress. Well, the problem is with stress again is that you would expect animals that come in from the wild or parent-reared animals that are far more stressed in a captive environment to have severe gastritis, to see episodes when you move an animal from one facility to another, suddenly they would get a serious problem with gastritis. We don't see any of that. That pattern doesn't exist anywhere in, we just see this low-grade gastritis that just gets worse over time. And then, as I said, usually there's some associated with the feeding frequency and the type of food that they get, rather than the actual stress on the individual at the time. But there are still many of my colleagues who still believe that stress is the primary or the main cause of this. And then the dietary causes, which we've discussed extensively. Colleague of mine did look at some of the diet-related causes, or this was just where they were feeding 2 different diets and whether they got gastritis or not. And part of this was where they were actually including IAMs. At about a third of the diet, those cats did a little bit better on the IAMs. But really there was no statistical difference between cats that were fed beef versus those that received some of the IAMs in terms of the long-term outcomes. Many of them still got gastritis. So for me, really, after having looked at so many cases now over time, the 2 things that stand out more than anything else is the low collagen intake, so high muscle meat. So if muscle meat is over 50% of the actual diet, they certainly seem to have a higher risk of getting gastritis. And then the other thing is the feeding frequency. Right? So if they fed twice a day, they're at very, very high risk of developing gastritis. Some of the study, the initial work that we did was at Africat in Namibia, where we just basically biopsied all the animals at the facility every year over a period of time from 2015 to 2018. It was roughly, they were 3 to 15-year-olds. All of them were born in the wild. None of them, breeding cheetahs in captivity in Namibia is illegal. And so these were only rescue cats, usually cubs that came into so they're all wild born. So genetically, it's not as if these were inbred or had a particular, issue with their genetics. So we had 86 sample sets from between 15 and 30 cheetahs each year, depending on, who was still around. Some of them were fairly old. So this just shows you the progression over here. Very interesting because 2015, you can see things getting progressively worse between 2015 and 2017. So grade 3 gastritis is the red, grade 2 is the orange, and then grade 1 and 0, I grouped those together, are in green. Something happened quite suddenly at the end of 2017 to 2018, and I think they finally got my message in terms of what to actually feed these animals, and mainly got many of them over onto a much higher collagen diet and changed the feeding frequency. So you can see what is interesting too is that if stress was a real big problem and was causing this, clearly there's an increase of stress over time if that was the main thing, and then suddenly something happened and they were all, I don't know, put onto Prozac or something that stopped stressing, or whatever stressor was there just went away. I mean, there was no such change. And these are all animals that are in fairly large enclosures. They are captive because they are being fed. But there are no real visitors. Well, actually, some of them might have had some visitors that will come past from time to time. But vast majority of those cats were rescue cats at a big facility where they would only see the keepers once in a while. So there's virtually no pressure on them. All their food is provided. They're protected from any of the leopards. The leopards can't get into their enclosures. So really, they don't have to be vigilant at all. So it's really difficult to imagine that these animals are really stressed. If we looked at males and females, not really a major difference between them. Males slightly worse than females, but wasn't statistically significant. And then if we looked at the age group, so 1-year-olds right on that side over there, we didn't have too many between, sort of younger animals. Most of them were sort of getting older at that stage. So from 5 to 15, maybe a slight progression as they're getting older, getting worse, but it's really present across the entire spectrum. In terms of serum biochemistry, so we take a blood sample, run typical sort of veterinary analyses, blood tests that we do. We didn't see very much, except for some changes in the serum creatinine and albumin levels that were statistically significant. And yeah, just to show you some of the serum creatinine was slightly higher in grade 3 compared to grade 2 and grade 1. Okay, but again, the problem here is that the actual difference that you get is so small that you wouldn't be able to use it as a diagnostic test for that. If we looked at the serum albumin, so this is the main protein that's produced by the liver, and it's the main protein transported in the blood, serum albumin. Okay, the albumin levels were higher, in the either those that had no gastritis or a very mild gastritis compared to those that had severe gastritis. And that does make sense to some extent in that you have this maldigestion syndrome, which is going to mean that they're not going to absorb a lot of nutrients, right? So a lot of stuff is passing through the gut, and therefore the serum protein may be affected by that as well. If we looked at serum cortisol, now measuring blood cortisol levels is not that great, especially if you're mobilizing the cheetahs anyway to collect the blood samples, so there's a reasonable amount of stress associated with just the immobilization. But just as a kind of way of just checking, we did spot metering over here, and there was actually no difference between grade 1 and grade 3 gastritis. So the overall baseline single blood cortisol levels were not any different. Again, really indicating that we probably don't have any major stress issue there. Okay, and so looking at urine, it's an interesting thing, trying to get many veterinarians to actually collect a urine sample on a cheetah is quite a challenge. I mean, it's actually very easy to do, both in males and females, just catheterize them. And even in the females where, it's quite, you can't see the urethral opening, I've got a fairly good blind technique that we just get a little feeding tube in very, very quickly. And it gives me so much information normally. I can tell you immediately after getting a urine sample whether the cheetah's got issues with renal failure or not. If it's urine-specific gravity, which is the concentration of the urine is very, very high, I can immediately tell you that cheetah's not got renal failure. If it's low, then I say, well, okay, now it might or might not, but I could at least tell you that it doesn't have renal failure if it's got a very, nicely concentrated urine. But so we often look at urine-specific gravity, and the urea level in the cheetahs, which we measured as well, were significantly different. But again, so here's the specific gravity. The specific gravity going down in grade 3 gastritis is fairly normal. You can see how they have very, very high concentrations. These concentrations are much higher than dogs and cats. And it's primarily due to the massive amount of urea that they actually produce in the actual urine. Urea is the main dissolved compound in urine that gives it this very high concentration. And then looking at urine urea, as expected, you're going to have a fairly high concentration of urine urea. And this may also have to do with that whole maldigestion. If you don't digest proteins, you're not going to have the proteins broken down into ammonia. Then the ammonia is not going to be converted into urea as well. So you'll have lower levels to excrete. This was just interesting at Cango Wildlife Ranch, the Tamlin work. So we did a glycine supplementation trial here with one of my PhD students, and it was quite interesting. So we managed to convince them to feed quite a lot of collagen initially, but then for the study, because I didn't want the collagen to actually interfere with the actual supplementation of the glycine, we had to put them onto a meat, muscle meat only diet for at least a month before the trial started. And so they had for a long time been on quite a high collagen diet, and then when we actually sampled these cats, initially at the baseline, we found that very few of them actually had any problems. There was only one grade 2 gastritis, so that's the baseline on that side. We had 5 of them that had a grade 1, and then 4 of them had no gastritis at all. That wasn't quite what I was expecting, but and this was after a month of putting them onto meat, so it does take quite a while before you actually start developing the problems. Then it was a crossover study, and we found that the difference there wasn't much of a difference between those that we supplemented with glycine and those that we did there. I mean, it's a slight difference in that at least 2 of them then went on to develop, grade 3 gastritis. And the glycine supplementation did seem to help a little in that we only had one animal that had grade 3 gastritis, but it wasn't, that profoundly different. So what I concluded out of this thing is that the baseline diet was far better than even supplementing with glycine. If you'd have, and so the 2 possibilities: either the amount of glycine in the collagen that we're giving is way much more than the 30 grams that we were giving them as a supplement, or that there are other compounds in the collagen or other issues in the collagen that are benefiting these animals significantly. All right. So unfortunately, they're a fairly short-term study, and we would need to look at much longer changes. It's very difficult to actually quantify the amount of collagen in a diet. When you're getting every day, you're feeding bits and pieces, if you have to kind of try and separate everything out. And to try and buy collagen as a, powder or anything like that is incredibly expensive. So, and you would have to give these cheetahs very large amounts of it, to be able to do. So it's not like a lab rat that you can, feed a very, very specific diet. You've got a lot of constraints in terms of, and variables that are very difficult to manage in this kind of research. So it's going to take us a little while still to get, to a definitive answer. This was just to show the individual animals over there, all their names over there, and how they changed over time. And so those that were not on glycine certainly got a little bit worse. And the longer they went from the baseline diet or the previous diet prior to baseline, the worse they actually would have gotten. All right, so the current treatment recommendations, just from a veterinary point of view, that obviously the diet change is by far the most important thing. Reducing muscle meat to less than 50% of the total diet, and if eating any form of collagen. Now, collagen is the most abundant protein in the body, but it's found mostly in things like skin, cartilage, tendons, lung, aorta, the bones. Important thing here with the bones, again, we've mentioned that it's very, when you have a severe case of gastritis, you don't want to suddenly start them on bones. Because they may not digest them very, very well, and then you're going to end up with a bone stuck in the intestine, which you're going to have a whole other problem. It's going to have to be removed. We often try or treat them with one type of antibiotic. Usually it's just an amoxicillin clavulanic acid or something of equivalent that is going to basically be there to reduce the amount of bacterial inflammation in the small intestine. So that small intestinal bacterial overgrowth, that's what I want to get rid of. I want to get rid of that inflammation, and so 7 to 10 day course of that would really reduce the amount of inflammation dramatically in the small intestine. And then we absolutely don't use any sort of proton pump inhibitor unless there are very specific ulcerations. Sometimes you can use something like one of those protective things like Ulsanic. It's just a bit difficult to get it in orally in cheetahs. And then we supplement them with, we have a gastric acid supplement that has got creatine monohydrate, glycine, vitamin B5. Vitamin B5 really is there to provide them with coenzyme A. I mean, vitamin B5 pantothenic acid forms an integral part of coenzyme A, and so it really pushes up their coenzyme A levels. So that we try and treat them with. And then very high doses of niacin, which is vitamin B3, up to 100 milligrams per day. It's very, very high. That's very few studies in humans that have shown any dietary things that are there that will increase hydrochloric acid production, but niacin is one of them that potentially can do that. But again, these are massive doses compared to what you would have. So you have to buy nicotinamide or niacin. You get them fortunately in big tubs, and you can supplement with that as well. And then more starve days, basically just increasing. I mean, I would possibly try and push them to feeding, if they're really severe, try and only feed them on 3 days a week if you can get them down to that. So those are the kind of main treatments. Feed 3 days, starve 4. Yeah. But I mean, again, I would do it on an individual basis. If you're really struggling with one, I would try and push those fasting to more and more fasting days. If you've got the rest of the diet right, and they still are occasionally vomiting or have a soft stool, then push them even further. Even if you have to end up with twice a week feeding, they will not die. I promise you, they will be absolutely fine. Again, the main thing is to monitor body condition and body condition scoring. And I mean, there's a 9-point scale where you can visually monitor body condition in cheetahs. And I think it's, having people that are trained to be able to observe them and do that scoring once a week or so, then you can adapt the amount of food that's being fed, based on that. Yeah. And you build them up over time, again, because I said that stomach doesn't just automatically expand or, to a full-blown size. But when a cheetah is eaten properly, I mean, it should look pregnant, that's the fairly typical thing. And as we've argued, we think that extension does make those animals feel satiated and satisfied. Any small swelling of the stomach, really, they don't ever feel like they've actually eaten enough, So that's pretty much it, yeah.